So right now we're planning to do a full face and neck treatment on this patient for skin tightening. And if you want to select a candidate, this kind of skin on the neck, which has that very fine kind of folding, we call it crepiness to the skin, is really something that improves dramatically with this procedure. So we like to do this all the way from this part of the back of the neck up onto the lateral part of the cheek, under the orbit, and down to the base of the neck. This whole area will be my left side treatment area. When I treat that area, I will divide it into probably 6 sections. If we turn a little bit more, thanks. This will be kind of section 1, section 2, section 3, section 4, and then up on the face will be 2 areas. Those are not things that we have to stay within the limits of those sections, but it gives you kind of the best size area in order to keep the continuous motion, get good heating quickly, and not go beyond that pain threshold. So this is a very comfortable treatment. So I'm going to go ahead and put some jelly. Now I've already tested this patient's skin temperature before we start. She's starting at about 28, 29 degrees with our external gun, which is really our only tool at this point that we can use to determine just what kind of energy we are delivering. I'm setting my settings on my SkinTyte monitor. I do 1 pulse over 11 seconds, and I've been delivering 150 joules in that 11 seconds as 1 pulse. This is kind of what I have found is the maximum energy over time that works comfortably in the areas that I'm using as far as the size of area. It could vary depending on patients, but I want to get that change in temperature. Usually I heat the temperature up about 10 degrees, which will reach a place where she's still comfortable but feels the heat, and then I see some pink change in the skin, which tells me that we are getting an effective treatment. So we will start with 150 joule fluence, 11-second pulse length, and I set no post-cooling with motion because you don't really stay in one spot that requires cooling after the crystal is removed. One other thing I might want to show you, I think you can see on the end of the handpiece there's a crystal cover. This is that smoothie we were talking about. It can be removed. There's your cover. It's just a magnet that holds it over the sides of the lens, snaps on very easily, allows the edges to be very smooth along the side so that we don't have anything that's irritating the skin as we move. So we'll go ahead and start with a pulse. So we're going to start and just feel, this will feel a little warm as we go, and you're just going to tell me if you feel anything that's really uncomfortable as we move. I generally will do 1 area, about 3 pulses on the first pass. And 1 more. Start to warm up. We've already got a little bit of redness you can see in that area, and she was feeling it be warmer enough that it was obviously changing that skin color. I think you can see that. So we move to the next section. Now she got a little bit warm before we'd even finished 3 pulses, so I'm going to do each section 2 pulses, and then we'll start joining the segments. When we're closer to the jawline, the energy tends to be a little bit absorbed by more over bone, and it gets hotter quicker. So you just, we're going to continue down in this segment. So then we're going to just start to overlap the segments a little bit so we move in a different area.
It's warming up.
Okay, then I'll move. So basically you can move, as you see the redness, you can change your area, and then I generally, once I've started to get the temperature kind of up, then we can start kind of moving over a larger area to just maintain that response. Some patients do get very sensitive if you stay in a smaller area, then I just extend the area. As long as I'm seeing that I'm getting the energy and I'm getting that pink response, I can move those energies around, those segments around, so that we don't have to be on one spot. So I can feel the temperature with my hand, quite warm there, and we are getting really a nice erythema, which is comfortable but still enough on that spot. So then we'll come over the jawline a little bit. And add that to our treatment area. And you can move up and down and circular. It's really not, it's just getting a feel for how the skin looks and how the patient feels. And this area, you don't stay on one spot too long over the jawline because of the, I'm putting 150 joules per pulse. It's really 3 times what we would, more than 3 times what we would necessarily be delivering in a stationary technique. So it's certainly okay to have a fairly large area as long as you're seeing your energy and your redness and your heat is just
Starting to get warm.
And she's starting to be aware of the warmth. Then we can just stay off that bone for a minute. Then we'll do one right up on the face. And then over the lateral cheek. It really doesn't matter, as I said, whether you find it's going to glide easier on the particular facial features of the patient. If you can move easier in one line than another, there's no rules to the area that you consider a segment. You just want to make sure that you're not overheating one area that's making it uncomfortable, and you're getting the whole area to stay to temperature. We're getting, over the cheekbone, you'll find that it gets warm a lot quicker. And to do the detail areas under the eyes or along the upper lip, we move to a smaller tip smoothie, which really makes that possible to treat as well. So you can see now, and I can feel that this whole area is now quite pink, but you're still comfortable, and the neck is still maintaining some of that energy. So we've done about 35 pulses, and that's probably all I would do on that treatment side, and she's pink, but not uncomfortable. You can feel heat. I don't know if I'll get anything with this. She's 38. It actually cooled down a little bit after but anything from 38 to 41 is kind of what we end up achieving with the energy, and this you can certainly see the redness, I think, all the way maintained in this treatment area. So what I would do next is move to the center. I tend to treat this central part as a separate area so I can really get some tightening on this under the jaw, under the chin. Everyone loves to see that as tight as possible. We tend to get a lot of people that, because that's always a little bit crepey and folded, they can call it their turkey neck if it's really got a lot of redundant tissue, but they'll see lines from just sun exposure because none of the creases are ever seeing the sun. So Kathleen does a very good job with taking care of her skin, and she doesn't have any suntan lines, but definitely this is a treatment area that really we like to cover specifically for patients. They're always going to ask you, did you get my skin under the neck, under the chin, on the neck? And one of the places we can see our best results. So we do the same thing. We just kind of find an area at the base, call that our section 1, and we do 1 or 2 pulses. This area heats very quickly because you're, in fact, right on a thin skin area over some vessels, and people really will notice that warm up pretty fast. And then we'll just come up into the second section. And you really just kind of customize how you move it. As long as you keep it moving, they won't complain. And you can tell by just how the skin is responding. If you have an external temperature probe, you can check your temperatures, trying to see that we stay, really for sure should stay under 42 degrees, because we know the skin deeper is certainly warmer than what we're seeing on our external probe. And we don't want to get to that 44 degrees where we actually destroy collagen. We want to just melt bonds and get remodeling. So generally in this section I do 10 to 15 pulses, depends on the patient, and so we'll do 1 more in here. And that should be pretty good. You can see the pinkness. On this side. Okay. Again, you can feel the temperature. You certainly will feel the skin quite warm to touch. And you can see there's a pretty even pinkness to the skin, so you're really getting and feeling that. I know from experience that's going to be at about 39, 40 degrees. When I want to do a smaller area, especially if I'm using the small tip smoothie for over the lip, upper lip or under the eyes, then I usually decrease my pulse length to about 8.5 and take the joules down to about 100, which is a somewhat comparable setting. The reason is the area is so small. You want to be able to do a very small still motion technique in a small area. You usually have a shorter pulse. It's just a lot easier to manage. And then you can reposition to a new area and not get too hot on the skin before you need to go to your next pulse. So those are my settings for the small tip smoothie, doing upper lip and under the eyes. And under the eyes is the same thing. I try to break it into 2 sections, but I usually find that you have to really keep moving. You can turn a wee bit so he can see a little better. And so we'll do a pulse under the eyes, and it's just the same idea. And usually I can deliver 5 pulses per side. And it's just a question of how quickly do you move, depends on how much they feel it. and how much you see the pinkness come up. And it's almost as predictable as it can possibly be, is that by pulse 5 you'll see some redness, and they'll tell you of some warmth. How you doing there?
I'm feeling just a little warm.
Yeah, so she's starting to feel that warmth, so we can start doing a little bit more. She's pretty good, so we can do kind of this area, a couple more pulses, and the more energy the better. We're still getting something right over that lower eyelid and lower orbit area, not actually into the orbit, but just below on that, again, where the loose skin tends to sit in that tear trough. And this can be done, really helps with people that do fillers here, because that really increases the amount of tightness over that skin. Over the filler just gives them an even better result. They don't see through the skin as much. It's actually giving them a little bit thicker skin there. Just that denser collagen on that thin skin just really helps cover or smooth out those lines and cover that venous pool that we all have. So you can certainly see that there's some redness and see the smoothing. These lines that were over here are literally gone. And then we'd repeat the same process on the other eye.